My name is Dr. Constancia Chioma Ezenwama. I am an optometrist practicing in Lagos State. Eye is very crucial. It's one of the sensory parts of the body that help us to see and navigate around the world. The difference is clear. The optometrists, they are the real doctors, the real eye doctors. They are the one that helps to prescribe, diagnose some ocular diseases. They prescribe corrective glasses and contact lenses, and they refer to an ophthalmologist, which are the eye surgeons. Those ones, they are the one that operates the eyes, such as cataracts and glaucoma. But opticians, they are just technicians. They are the one that fits lenses, prescribed by an optometrist. Eye health is very interesting. I fell in love with eye practice when my elder cousin is an optometrist. He always tell me about the practice. From there, I fell in love with the profession. The common ones are the refractive errors, which are myopia or short-sightedness, hyperopia, or you call it long-sightedness, astigmatism, and also presbyopia. Myopia means short-sightedness. When you find out that you can't see things that is far from you, but when it's close, you can see them, that means you're having myopia. And in that situation, you need glasses, corrective lenses that will help you to see things that is far from you. Then hyperopia is long-sightedness, things that is close to you, you can't see them, but when it's far, you can see it. At this situation, you also need glasses that will help you to see things that is close to you, to avoid straining. Because when you keep straining your eye, you start having headache and eye strain. Then astigmatism, both far and near is blur. At that situation, you also need glasses that will clear your vision at far and near, because there is irregular curvature of the cornea that is giving you that blurriness. You also have presbyopia, which is age-related condition. When sometimes it happens to our parents, when they find out they cannot read tiny Bible, they start shifting their hands above the arm's length, and they start tilting their head or start needing extra light to read. That means they have presbyopia. Those ones, they need glasses to read, so they will not be straining your eyes, because if you keep straining your eyes, you are causing more harm to your eyes. At all age, even babies have eye conditions. Some children are born with eye diseases. Some children are born with glaucoma. Some children are born with conjunctivitis. So at all age, it requires for everybody to check their eyes at least once or 2 times in a year. I will not advise parents to get any glasses for their children unless they go through a thorough eye examination, and the optometrist in charge now discover that their child is having any refractive error, and if there's any need for it, they will give them their corrective lenses. They don't just go and be wearing all those recommended glasses. I will not advise parents to do that. Genetics play a big role, because once a parent or grandparents is having glaucoma or myopia or other refractive error, there's tendency that the children or the grandchildren will have it. So genetics play a big role. Yes, there's some habits like wearing safety wears in industrial area, because some industrial areas are hazards to the eyes. You have to wear your safety wears or safety goggles to protect the eyes. Then people that use laptop a lot, you need your blue cut lenses, blue cut photochromic lenses that will help to protect your eye from any harmful blue light coming out from the screen, because this harmful blue light can cause cataract, it can affect the macula, and it can also cause dry eye. Yes, because now we are in a digital world. Everybody's using laptop, and this laptop has a UV radiation that damages the external part of the eyes. That's why the eye diseases is common now. So in worldwide, not just Nigeria. Okay, screen generally has a UV radiation that damages the external part of the eyes. So for us to protect our eyes from all those harmful blue lights coming out from the screen, we need a blue cut photochromic lenses and other anti-reflective lenses that will protect our eyes from those harmful radiation from affecting our eyes. And also, while using all those blue cut lenses, you still have to rest your eyes. Don't stay too long on the screen. Reduce your screen time, because the more you spend time on the screen, the more you are risking your eye to all the eye diseases. So you need to at least give your eye a break while using the screen. Yes, certainly, because carrots and certain fruits such as oranges, watermelon, pineapple, fresh tomatoes, all those ones, they have vitamin A, C, and E. Vitamin A supports good vision. Vitamin C helps to nourish the blood vessels and also protect our eyes from harmful blue light. Then vitamin E also helps us from protecting our eye cells from any visual damage. So all those vitamins that is inside carrots and other fruits help to nourish our eyes. So it's good and advisable for us to consume more of it. Yes, like exposure to chemicals and industrial areas without using your safety goggle can also damage the eyes. Then rubbing our eyes, some people are used to that. Whenever you feel that your eye is itching you, go to an eye clinic and get your eye examined. So when you examine your eyes and the doctor find out that you're having allergic conjunctivitis, they will treat you of the allergy so that you not keep rubbing your eyes. Because if you're rubbing your eyes, you're risking your eyes for you start having cornea ulcer, cornea abrasion, scar, cataract, glaucoma by that rubbing of your eye. So you need to just get your eye examined and get a proper treatment. Wearing of glasses doesn't worsen the eyes over time. People just have that ideology, but it's not true. Why they are saying that is that because people that are like presbyopic patients, normally when you are aged, you need glasses to read. So the more you are aging, the more you need glasses to read, and the more they are increasing the power of the lenses. That's why people think that when they start using that glasses, they'll keep using it and it will worsen their eyesight. It doesn't worsen their eyesight. It's the age that is affecting the lens. The more we are aging, the lens and the eyes is aging. So we need more lenses to read. Those ideology they are saying wearing glasses worsens the eye, doesn't worsen the eye, please. This is a plastic frame and this is a metal frame. Some people will prefer using this plastic frame because plastic frame doesn't really absorb heat. It's light, it's free, like the sun will not be hurting you. But if you're using a metal frame, it's not really comfortable while walking on the sun with a metal frame, but it's free to walk around the sun with a plastic frame because this one doesn't absorb heat. Then plastic frame, some people are so careless. That's why they always go for the metal frame. Because the plastic frame, if you didn't handle it well, it may break. But the metal frame lasts longer than the plastic frame. Firstly, when your optometrist prescribe you a corrective lenses, try and handle it with care. Then always wear your glasses. If it's a corrective lens, always wear it all the time, unless you want to sleep or you want to bathe. That's where you remove your glasses. When you remove your glasses, don't just drop it like this. Some people just go and fling their glasses. Don't drop it like this. You have a glass case and you have a lens cloth. So when you remove your glasses from your eyes, you close it like this. Open your glass case. Place your lens cloth, then put in your glasses and close it. Drop it. When you wake up in the morning, you just bring out your frame, your case, open it. When you're bringing out your glasses, don't just wear it immediately. You have to clean it thoroughly. When you clean it, take your time to clean it. Then you put on your glasses, you go. By doing so, it will avoid scratches and also smudges on it. And also, it will help you to protect your eye from any bacteria that might be on the lenses if you are cleaning it always. Okay, I would advise Nigerians to go for a regular check. At least, even if you're not having any sign about your eyes, always check your eyes at least once or 2 times in a year. By doing so, we will be able to detect some eye conditions that can lead to blindness, because early detection is the key. And by doing so, you'll be able to keep your eye healthy. And also, for elderly patients, they need to be checking their eyes. By checking your eyes, be able to manage it properly by the optometrist. The optometrist will place you on what we call an antioxidant. This antioxidant play a big role on the elderly because it protects your eyes from any retinal degeneration, because the more we are aging, our eyes is aging. Then reduce your screen time. Generally, if you're using laptop, you have your blue cut lenses, always don't overdo things, just reduce your screen time. It helps you. Then also consume a lot of fruits, carrots, watermelon, cucumber, orange, egg. Eat egg. You can eat cheese, sweet potatoes. All those things have vitamins that nourishes the eyes. Then take more of omega-3 fatty acid. They are the fatty food that helps to protect the eye from inflammation, help the tear production, because the tear production of the eyes helps to nourish the eyes, and it also helps to protect the eye from any cellular diseases. Vitamin A support the good vision. Vitamin C, all those vitamins helps nourish your eyes. So once you're checking your eyes and taking all those vitamins, you keep your eye in good health.